The Health Reference. Medical topics made easy. Today, we're talking about type 2 diabetes. It is one of the most common health issues in the world, affecting hundreds of millions of people. Yet, a lot of people don't really know what it is. Some think it just means eating too much sugar or having a sweet tooth. But the truth is a little different. Once you see how it actually works, it makes a lot of sense. Let's imagine your body is like a busy little town. Inside this town, there are millions of tiny houses. These houses are your body's cells. Every single house needs electricity to keep the lights on and the fridge running. Your body's cells work the same way. They need energy to do their jobs, like making your heart beat, your brain think, and your muscles move. Without energy, the whole town shuts down.
So where does this energy come from? It comes from a simple sugar called glucose. Don't worry, glucose isn't the bad guy. Your body actually needs it every single day. Whenever you eat things like bread, rice, potatoes, fruit, or pasta, your tummy breaks them down into glucose. Next, that glucose goes into your blood. Think of your bloodstream as the town's roads. Tiny delivery trucks drive along these roads, carrying glucose fuel to every single house in town. But here is the catch. The delivery trucks can't just drop the fuel on the porch. Every house is locked. To unlock the doors, the body needs a special key called insulin. Insulin is made by a small helper organ behind your stomach called the pancreas. Think of the pancreas as a key factory. Whenever you eat and sugar enters your blood, the factory quickly makes insulin keys and sends them out onto the roads. The keys unlock the doors, the glucose goes inside, and the houses get their power. Everything runs perfectly, and you don't even notice it happening. So, what goes wrong with type 2 diabetes? Surprisingly, the factory doesn't stop making keys. The real problem is that the locks on the doors start getting rusty and worn out. Imagine trying to open your front door with a key that fits, but you have to jiggle it, push it, and fight with it just to get it to turn. Doctors call this insulin resistance. The keys are there, but the doors won't open easily. Because the doors stay shut, the delivery trucks get backed up. Glucose starts piling up on the roads instead of getting inside the houses. The key factory notices this traffic jam and says, "Uh-oh, we need more keys." It starts working overtime to make extra keys. For a while, this actually works. The extra keys force the stubborn doors open, and things look normal. This can go on for years, and the person has no idea anything is wrong. But no factory can work overtime forever. Eventually, the factory gets tired and slows down. Now, there aren't enough keys, and the locks are still broken. Even more sugar gets trapped on the roads. When that blood sugar gets too high, doctors call it type 2 diabetes. How does someone get type 2 diabetes? It's usually not just one thing. It's often a mix of things over a long time. First, it can run in the family. If your parents or siblings have it, your body might just naturally have a harder time with its locks. Second, carrying extra weight can make it harder for the keys to work. Third, not moving around much plays a part. Think of your muscles like busy warehouse workers. The more they move, the better they are at using up that fuel. If they sit around all day, they get lazy. Finally, getting older makes it more common, though young people can get it too. Remember, these are just clues, not guarantees. Everyone's body is a little different. Since type 2 diabetes builds up so slowly, how do you even know you have it? It's sneaky. It doesn't knock loudly, it creeps in. But as the sugar builds up on the roads, the body sends tiny warning signs. One of the first signs is feeling super thirsty and going to the bathroom a lot. Remember the traffic jam on the roads? Your kidneys act like the town's cleaning crew. They see all that extra sugar and try to wash it away by making you pee. But sugar drags a lot of water out with it. You lose water, you pee more, and you get incredibly thirsty.
Another sign is feeling totally wiped out. Imagine it's freezing cold and the firewood truck is parked outside your house, but you can't open the door to get it. You have plenty of fuel, but it's stuck outside. Because your cells aren't getting their energy, you feel tired. Other clues include blurry eyes, cuts that take forever to heal, or a tingly, numb feeling in your hands and feet. But guess what? Many people have zero symptoms at all. They feel totally fine, which is why regular doctor checkups are so important.
To find out if someone has it, doctors do a simple blood test. A popular one is the A1C test. Think of it like a school report card. A regular test tells you your blood sugar right this second, but the A1C tells you your average grade over the last 2 or 3 months. It gives doctors the big picture. If someone finds out they have diabetes, there is great news. You can still live a long, happy, healthy life. The goal is just to clear the traffic jam and keep blood sugar normal so it doesn't hurt the body.
A lot of times, treatment starts with healthy habits. Eating good meals, playing or exercising, getting good sleep, and staying at a healthy weight. Sometimes that's all it takes. Other times, doctors give people medicine or extra insulin keys to help out. Every plan is custom-made for that person.
If it's ignored, though, that high sugar traffic jam can damage the town's roads over many years. In your body, those roads are your blood vessels. If they get damaged, it can hurt your eyes, kidneys, heart, brain, and other areas of your body. But this happens very slowly, and catching it early prevents that damage.
Plus, science is getting amazing. There are awesome new medicines and even tiny wearable patches that check your sugar automatically without needing to prick your finger anymore. So, let's wrap it up. Your body is a town. The roads are your blood vessels, the houses are your cells, glucose is the fuel, and insulin is the key. With type 2 diabetes, the locks get stubborn, the keys don't work well, and sugar piles up on the roads. Keeping that sugar in check protects your whole town and keeps everything running smoothly. Thank you for watching The Health Reference, where we make health and medical topics easy to understand. Be sure to like and subscribe, and we'll see you in the next video.